Hello, good afternoon. I am Lamin Jamba Jame, Vice President and the Coordinator of FOFDIC. What is FOFDIC? FOFDIC is the Foundation for the Development of Healthcare in Kartong. FOFDIC, in collaboration with its partners in the Netherlands, Equator Foundation, starts in the year 2004. You have a lot of projects that starts before Equator Foundation. All is about healthcare. But when FOFDIC has this venture with Equator Foundation, there are other foundations that build clinics somewhere in the country. But what they miss is they build wild buildings, and at the end, of course, when the sponsors are gone away, the money is finished, there will be no nurses, so you have less health care. So the good thing about FOFDIC and Equator Foundation is we start sustainable projects. Those sustainable projects, even if our donors say now we can sponsor, we still have ways to pay our nurses and to pay for the things that to sustain our own health care. With those projects, we start a lodge.
This is one of the many projects of the Equator Foundation. It's initiated to provide sustainable healthcare and development in Kartong.
That's true, Helen. Staying with Equator Lodge means sponsoring the healthcare of the community.
The lodge is entirely staffed by local people.
We have the assistant manager, Kadijete, in front of the computer. That's our kitchen. We have two excellent cooks. That's Baba Danso and Lamin Drame, the assistant cook. One of the pride of Equator Lodge is that we have excellent cooks here.
That's my chef, yeah? Baba is the good chef throughout South Gambia.
Thank you. That's my love. I like the job.
There is no main electricity supply in this area. We have a solar system on top of the roof and the wind turbine.
Generator.
The solar system is joined with the windmill here, where the whole power goes to the battery system with DC. There it goes from the DC, we turn it to AC from an inverter, which is just here. So the inverter takes from DC to the AC. That's 220 volt. This is what we use to supply the system at the lodges and the restaurant. We use it also to use the computer for administration. It's all sponsored by Kavundun in Netherlands, a foundation, and Fraxin Solar Company. We have 6 traditional round houses, all with en-suite bathroom.
This is one of our rooms. Come and see inside. Toaster, electricity. We have rooms inside the house. This is inside the bathroom. We have toilet. See how they call it, sink, shower.
And here we are on the beach. Look at the view.
Ñom ñoñu jural ñoñu togal ñom ñoñu fotal ñoñu setal nañ am yërmande ci jigéen ñi Gambia jigéen ñi Gambia fonk naa leen jigéen mi ñooy suñu yaay Ani wula da jadi yana duna Ani wula da jindula la wo muzolu wo jigéen ñi ñoo suñu yaay Ani wula da jadi yana wo muzolu wo duna Ali nga muzolu bu ñanni muna muzol mun na ñuludi Ali nga muzolu bu ñanni muzol mun ba ñuludi Almala musolle ka mansake wulu in dunia
Sana jom da ba
musolle
This is the pizzeria. We have a bar inside, and also we organize boat trips, and we have the best pizzeria in town. Oysters is not mainly only the food is also, it has the benefit from the food, but also the cells is used in the lime making, in construction.
Okay.
We organize also boat trips here with the engine small boat there. There you can see pelicans and all other varieties of bird species here, which are on the mangroves. You can also find, luckily, a crocodile in the river. And in front, in some meters away, we have oyster creeks on the riverside by the mangroves. Maybe you would like to do the trip with us.
Pretty good idea.
Yeah?
Yes.
That's good.
I appreciate that, but first I want my pizza.
So you are ready?
Gambia, Remi dina am jamma, bunyu bolo, bunyu degu Gambia, Remi dina am manang.
A lot of people use this for their, feeding, and mostly a lot of Gambians, we all eat this.
Yes, and is it especially for this area or for the whole Gambia?
No, for the whole Gambia.
Okay.
Especially for the whole Gambia, the bonga fish. Every landing side, there is a fisheries assistant like me. You should look at your area, what are their constraints, and those constraints, you should help them to, that landing side to come up, to have good catches, and so
it can be sustainable for a year from.
Very good sustainability in the village. Just like if I am only, it's my profession, fishing is my profession, and I have nowhere to do. I have to try to go into the sea. By then I will talk with the fisheries department. If those people can, sometimes they give them as a loan, and every month they will give you the machine, the boat, the net. Then I heard
they also give courses. Was that true?
The what?
Courses that they give special training for local people.
Yes. We have by then I didn't come even into fisheries. They have these courses.
Okay.
Yeah.
Okay.
Yeah.
Well, it's very, very interesting.
Yeah.
Thank you very much.
Thank you very much too.
This is the bakery. The bakery is of Musa Jare. Could you tell me something about the bakery yourself?
Okay, I was sitting for so many, maybe around 2 to 3 years. But I was a beggar, a bread beggar, but by that time I don't have my own oven. So I sit with the foundation to explain myself about the bakery. They start to sponsor me, and I build the oven. If I bake the bread, I take my bread at the shop for the shopkeeper to sell the bread for me. So when it's finished, I go and have my money. If the bread is not finished, that one also is my losses.
And what kind of bread is normally locally distributed? How does it look like, or how do you call it?
We call it tapalapa.
And it's white bread?
Yeah.
And normally people eat the bread all day?
All day,
just in the morning?
In the morning and night time.
At night time?
Yeah.
Okay.
Yes.
Okay, thank you very much.
Okay, thank you.
A long-term project the Equator Foundation would like to initiate is a chicken farm project. We were very lucky to find a local, Jerry Jane, who has a lot of expertise on this subject. Hi, Jerry.
Hi, Helen.
How are you?
Pleased to meet you.
Yes.
How do you do?
I'm fine. Could you maybe tell us something about your work experience with chickens in general?
I was with the Gambian Veterinary Department since 1969. Went to study in Nigeria, graduated from Ahmadu Bello University. 72, 73 went to Nigeria Federal Institute of Livestock Technology. From there I worked with NITA, that's Nigerian Institute of Tropical Resources Research, and then later worked in various departments in Nigeria, and finally came back home 85
to Kartong,
to Gambia. I just came back to Kartong last year. This is the effort we've been on for the past year.
Yes.
And I'm happy to say that we've just started with this small chicken farm, which we hope to grow into something big.
Yes.
And so far, this is the third lot that have come in here. It's local building materials we're using because we want to keep costs down, really. And this is mud blocks, and the building itself is what, 30 meters long, 10 meters wide, and divided into 3 sections. We have a mosquito proofing on the inside, and on the outside a wire mesh to keep away much bigger trouble. Each house is 10 meters by 10 meters. That's quite big, and it's supposed to take about 1,200 birds each. So that the 3 portions would take about 3,600 birds comfortably. That's adult, up to slaughter age. Now you notice the door is a little bit short, and this is because of control measures that will be put into place later. A disinfection pit actually would be dug beneath where I'm standing exactly. Now we have enough land at the back, enough land in front, and we might want to keep this same trend, keep costs down by making mud buildings, mud blocks. So we're talking in terms of maybe $120,000 to complete this. There are no feed mills in the Gambia. We import feed from mostly from Senegal or Ghana or Nigeria or what have you. What I have been trying to do here is to make sure that we produce our own feed locally. Like I said, these are the third batch, the third lot of birds that we've processed here. And throughout the period, they have been using our locally prepared feed. In that effort, we have had to bring in about 3 milling machines, small diesel-operated milling machines. Practically 95% local material, from yellow maize grown in the Gambia to fish caught in the Gambia and smoked in the Gambia, smoked in Kartong, Gunjur Kartong area actually, and then groundnut cake, Gambian groundnut, processed for oil and having the cake left. These two, the fish and the groundnut cake, constitute the protein content of the feed, whilst corn, guinea corn, and the rest of the stuff produce the concentrate or the carbohydrate content of the feed. Now, we use premix, that's mineral vitamins combination, which is 5% of the total production package, which means 95% of our feed is locally based. Only 5% is imported, that's the premix. Now, with that, we keep costs at least 50% down. With the help of this machine, we produce our own feed here, and successfully do. Now, with all this, we have 1.5 million people living in Gambia today. Most of them living on very, very little source of protein source. If Equator and organizations like Equator have in mind plans to help raise agriculture, raise chicken production, raise other types of things for kids to improve on their dietary needs, I would definitely want to give my hands and help wherever it is possible and whenever it is possible. So please, we need anybody who can help the children of Kartong, the people of Kartong, and the children and people of the Gambia together. Any effort, material-wise, financial, moral support, to Equator and help Equator realize their laudable aims. Thank you very much.
Well, if she has any problems, don't hesitate to come. If she has problems, don't hesitate to come to the Kartong clinic. They can refer the girl to a major clinic if necessary, especially because you can see little cuts back to Kartong, because I understand you've been asked by the village committee. What was your main reason to come back to Kartong?
You know, I have worked with the Department of Sexual Health for almost 27 years as a laboratory technician. Okay. The first approach was done to me by Lamin Jamba. When he met me, he told me that he has a friend who wants to open a clinic here. But in turn, okay, that clinic they also need a laboratory guide. So I said, okay, fine. So never mind, with my 27 years of service, it's better for me to come back home, because in that case I'm going to serve my old people. So I went to meet the director of health and to my boss to discuss with them. But never mind, they never wanted me to come, because they said this place is a starting. Most of the tests where I'm doing in charge of the hospital lab, and coming back here is going to be a waste of my knowledge and this. I told them that, yes, fine, but my people need me.
the service.
Yes.
So even with guys, for my coming out to Gambia is because of my family and other things. So what about when many people need me to go and stay at home so as to help them? So for that reason, this is why I came back home.
I understand the Kartong village is still in a development stage. It has been isolated for a long time. Can you also see that concerning healthcare? There was some traditional practices here. There are some main people working on the traditional medicine. They are still working here as well? Or?
You have those type of people here. And I know still they are doing it. But now with this Western thing, most of them, you know, those days they go with traditional medicine. But now they start with the hospitals first. And if they find out that, okay, maybe this cannot be cured, sometimes that is why sometimes they just come to go on with the traditional medicine.
Okay.
With the clinic here, they will just first of all start with the clinic.
Can you tell me something about the main problems concerning healthcare? What are the main diseases what you can find here?
Okay, with here, when we opened the lab from 2006 coming, most of these things we should sometimes, okay, malaria, let me take that as a big thing. You see?
I have a little kid here. Are those the main patients you can find? Little kids, elderly, pregnant women, or what kind of patients normally come here?
We have from the under 5, the adults and kids.
Under 5?
Yes. 5 and as the ladder goes on above, yes. Even the old people there come.
And if the old people can't come here to the clinic, does the clinic maybe go over to the people at their homes? Or
yes, we sometimes do that.
Possible?
Yes, sometimes possible. We find out sometimes when we find out somebody has a difficulty in coming. Okay, we sometimes even release our ambulance, or sometimes we go to take one of his cars and pick up any patient that we know and sometimes not come to the clinic.
Okay.
We will always send a nurse to go to the person.
What did you do before you came to the Kartong Health Clinic?
I was a volunteer in Red Cross, and I was volunteering in Polyclinic also. We are not that many, but we do try our level best. We have Abby and Sagar as a midwife. We have Lamin Bojan as the lab technician, and we have Usman Kamara as the pharmacy man, and myself as a nurse assistant.
Sorry, 1150 plus 250.
Kartong Community Pharmacy is part of Kartong Healthcare Clinic, mainly because of financial reason. It functions as a separated business unit. At this moment in time, beginning of 2007, the availability of essential quality drug at reasonable price is the main pharmaceutical issue for Kartong area. Here we have amoxicillin, chloroquine injection. This is for IM, for severe malaria, anti-malaria drugs. And we have chloroxycillin. We have metronidazole, flagyl for diarrhea and other adequate, stomach disturbance and so on. And this is miconazole cream. It's also for skin infections. We have all kinds of antibiotics here, and we have in a very reasonable price, whereby it is very cheap. You cannot pay fare to go to other places. You can have all your drugs here without going to other places in a very reasonable price.
ise konton yaman ise konton ni tata ise konton ise na mol konton je mfana bi jamba do manna okay.
This means from 2004 up to date, we've been working so hard to make it possible for the community to have good health. If you said Foundation for the Development of Healthcare in Kartong, it doesn't mean only Kartong. Kartong locates at a very strategic point of the Gambia. That is at the border. And with those borders, you have small villages around Senegal, which are Casamas. They live in a very remote areas. Those people already are attracted to come to Kartong. Thanks to our lab technician, who is an expert in lab techniques. Before, our co-partners used to tell us, because here, if you have, just when you are said you are sick, people just give you malaria tablets. But the good idea came with Equator Foundation. Now they give us a very good lab where we have a citizen of our own village who is a lab technician, who also now, before the doctor can treat you as a malaria patient, they give you medicine. They take you to the lab, test your blood, they are 100% sure that you have malaria, then they give you medicine to treat the malaria. This is the good part. The village is small, but the benefit of this foundation raised so high.
Yes, because the time I went to Nari, I find the Nari, they start to grow it. They start to plant it in their office. Yes. And they are here also, we have a good sun, and we have some places their water is not far. When you dig it, maybe in 2 meters, you have a water there.
So Gambia would be a good place for Artemisia to grow?
Yes.
Yes.
Only Artemisia, it will not grow long time.
Okay.
Only that
just one season.
One season.
In the rain season.
Yes. When Artemisia has seed, it will not bring the leaf again. That is our here's problem. When we have a seed, we can grow it. Because when you get 100 by 100 meters, just mean you have maybe 1,000 plants, because every meters you have one.
How much plants would you need to, if you are having malaria, how much plants would you need to cure the first stages of malaria?
What I discussed with the hand, first time we will have 100 by 100 meters, just like a one acre. When we have a 1 acre, we plant that one, just mean you have your 100 by 100, just like you have your 1,000.
But would you need 1 or 2 plants to boil, or 10 plants to boil, or how much?
No, you take only the small, not plenty, not have a big. That's why.
Just a few leaves?
Yes, that's why a few leaves. Well, that's why Hank, he want to use it in
an extraction.
In extraction.
He wants to make an extraction out of these leaves and put it in a little bottle.
Okay, just like a tea bags.
Yes.
They must use it. They must have a limit with the tea bags and use. Okay, just mean one person. How many grams they will use for this?
Yes.
For Artemisia to drink it.
Okay.
But when we use it like locally, because we blacks, we are drink medicine.
Yeah, that's what I thought, that it's very closely related to the traditional way of using a medicine, because a lot of traditional medicine are used using plants.
Yes, we use plants, and it not have a limit this year if you are drinking it. And the minister is calling permanent secretary, try to have good solution for about this Artemisia.
Yeah.
And the time of the meeting, Artemisia capsule was on the table.
Okay.
The WHO, you take this Artemisia capsule to tell the Gambian people, this is Artemisia capsule. It's a very good medicine. and it is cure of the malaria.
Is it a cure or a supplement?
Supplement malaria.
A supplement to together with all the existing medicine.
Yeah,
like chloroquine.
Yeah, chloroquine.
Yeah.
But you know, the chloroquine, when we check the chloroquine and the quinine, you know, chloroquine we use it in how many years we use in chloroquine in malaria?
Yes.
So many years we use chloroquine, we use and the malaria come to worse and more.
Yeah, we need an additional medicine, and
okay.
That's why Artemisia should be a good option. Right.
That's right. Sometimes when they grow them in small, sometimes they die because it is very, very difficult to grow it. Because it's very, very small. Nobody cannot see it in your eyes. You see, until you use microscope. You know, until you use that. And Artemisia is growing. It's very, very difficult. It's not difficult. When you understand how they grow it, it's very, very good.
And I understand the women's group have a lot of expertise concerning just gardening, concerning rice field production, so they would be able to learn how to grow Artemisia, yeah?
They must be learned. They must be learned to grow it. When they learn to grow it, they know it is very good. But before they will grow it, what we can do, maybe we can join with the Nare. Because Nare has a
research area.
They have the plate where they put the sands and grow it inside. You know. There we can take it there and come to the planet. And after that we can train the women. You know, time and time we can train them.
Artemisia is what I can see, if you use it as a plant or extraction of plants, it looks very closely related to the traditional medicine you normally would use here. You have a lot of experience as local people concerning traditional medicine, don't you? Could you tell me a little bit about that, how people use traditional medicine?
This traditional medicine, because here, many of them, when they sick, they start to the hospital. They went to hospital.
They go to the hospital,
They go to the hospital and they check themselves. If hospital, they use the hospital medicine, they don't. It is not changed. It's not. They don't.
Isn't effective.
Effective. They went to these traditional medicines.
Yes.
And there are some people who they will give you this traditional medicine, and when you drink it, you will find a good thing.
Yes.
Find a good. Yes, because many people they know about this Artemisia.
Yes.
If in the village here, and if Brikama also some family they know about this Artemisia. Yes.
How come they know about it?
Because the time we are growing them, when their family has problem, we give them the leaf, and they're going to boil it and drink it. And they will feel it.
Okay.
Yeah. If Nare people, they don't call it in Artemisia, they call it in magic.
In magic?
Magic, yes.
They call it magic?
Magic. Because when you drink it, in 30 minutes time, you feel okay.
And normally you feel sick for at least a week?
Yeah. Sometimes when you drink it in 2 times, that complete year, you will not have a malaria. Yes, you cannot have malaria again, that year all.
Because malaria normally weakens the body. If you have it for a week, you feel very weak afterwards.
Very weak. Because why you are feeling very weak in malaria, I'm not a doctor, but I find some people, they are vomiting, you know, because when you vomiting, your body will be slack, because your water is going out. Sometimes they have diarrhea,
and high fever.
Fevers.
So if you can get rid of all those effects, then with Artemisia you would feel better quickly and can go back to work quickly. Okay, thank you very much.
Thank you very much.
and hope to speak to you soon.
Yes. Thank
Okay.
you very much. Well, sometimes my English is not good.
Ah, no worries, dear.
Yeah, I think helping foundations like the local organizations will be very much helping really the local people. Because if you check, it is real history since the good-hearted people start helping the poor people. We've been hearing from news, from radios, from televisions that thousands, millions have been pumping into Africans' accounts. But where are the achievements? We've been hearing people giving a lot of money to United Nations, in WHO, to help the poor people in the health. But nothing is working. So I think the best solution is what really Equator Foundation starts in Kartong. Because I can see a lot of people are looking up to that. So it will be very good to adopt such a system. Equator Foundation, also with the help of Pharmacie Mondiale, you can see they started pharmacy. Because if you check in the Gambia, some drugs are from the government, and of course some drugs come from the help of United Nations. But if you check those drugs, they are very much limited, that if you go to the clinics, they write you a drug that you need to go and buy to the pharmacy. So you can see it's too much commercialized. The pharmacies traders are too much, almost all are foreign traders. So they have no sympathy for the local people. So the best thing Pharmacie Mondiale and Equator Foundation start in Kartong is a real model to adopt in other communities. And if you check at Kartong, we have a community pharmacy where people pay the pharmacy fee. But despite all this pharmacy fee, we are 3 times cheaper than the normal pharmacies. This means the community themselves are helping to maintain their own pharmacy. They really have the good drugs. Before in Kartong, when you need a nurse or a doctor that writes prescription to go and buy medicine, you need to travel up to Gunju, or you go to Brikama, where you have Kairaba Pharmacy, the only pharmacy there that has almost available drugs. And you need to travel 30 kilometers to get that drug. But now, thanks to Equator Foundation and our main sponsors, that we have a local pharmacy that has almost the possible drugs available here. So it's a real achievement. So Equator Foundation is not stopping only at helping Kartong, but they want to develop also an idea to adopt this system so people are not too much dependent on governments. People can do it. We have done it, and we would like to do more. So with the help of our donors, we can achieve a lot of things. We have somebody here from Holland. She's going to spend 6 months with us here. That's Helen. She's been so hardworking. I can't imagine somebody from such a country coming to live with poor people in such. She is eating the rice we had. She is doing all her best to help the community of Kartong. So she is teaching us in a way that if even she is gone, we can still maintain our good things. That's I expect any other organization should do as Equator Foundation is doing. Because if you want to come here and live here to work, what if you're gone? What the community is going to do? So the best thing is teach the community how to do such things. So even if you are not there, they can still help. They can still do for themselves. This is the best system I can ever see. So there are a lot of things which we think can improve with the help of our donors. Equator Foundation has done the sample, and they want to continue helping the community or other communities, not only in Kartong. So with the help of any donors, it will be very much welcomed, because if you had seen this place, like if you see the project that they achieved, like Equator Lodge, it's one of the youngest lodges in the Gambia, but it achieved a lot of things. So maybe in some years' time, the Equator Lodge can be able to help to sponsor all the doctors. So this means even if Equator Foundation say, oh, bye-bye FOFDIC or bye-bye the health board, we are going to another community to help, we will say thank you very much, we are very much glad that you bring us up to this level. We will not cry, Because I've experienced, as a coordinator of such a project, a lot of people from other villages wrote to me asking me, oh, can you tell your guys to help us because we had sponsors and now they leave and now we have no drug in our clinic, we have no nurses. I said, look, the only thing you can do is you have to reorganize yourself, because through our experience, this is what we thought of before starting a foundation. If people, white people or Western people came with a lot of money and pump money to you, the money is never too much. You have to find solution to that money that can make your project sustainable. This is why I give real cheers to Equator Foundation. Equator Foundation had done the best with the help of FOFDIC. As I said, FOFDIC also had passed a lot of difficulties, of course, because if you start such a foundation, people think, oh, there are a lot of money that comes from the West. Yes, even if the Western people give you millions, but you should ask yourself, why am I giving this million? Is this million going to continue sponsoring me for life or helping my community for life? How do I spend this million to help the community to sustain their own projects? I am telling things that make it possible for Equator Foundation and FOFDIC to come to this stage, and even thinking of going further. If you check it, starting such, because some of our donors become a bit worried. We've been giving these people money, but we have not seen a clinic yet. And also sticking, Ebina is sometimes worried. I said, I personally, as a coordinator, I said, please wait, because we can't just go into building wild houses at the clinic. People will see the structure of the building, but at the end you have no nurse to pay. You have no ambulance to drive because you need petrol, you need to employ a driver, you need to pay for a doctor, you need to buy drugs. Where would that money come? If we are given $1 million and we pay all that money to the hospital, to the clinic, build a wild house, start employing a doctor, and at the end we have no other sponsors to continue. I've seen it. So it's reality. So we start a lodge. With the help of that lodge, thanks that so people should know, coming even to Equator Foundation, coming to Equator Lodge, spending your holiday here is a real help to the community. You are sponsored. Have your fun, have your holiday, enjoy our beach. It means enjoying, helping the local people. This is the good thing. The whole staff in this, in the Equator Foundation or Equator Lodge are all local people. That means the local people find opportunities to have jobs for themselves, and even with the job they have can help the community. This means they are sustaining their own health care. It's a fantastic idea with the help of Stichting Ebina or Equator Foundation. I'm saying a great thanks to all the people that have done all the effort to bring this foundation or this organization to a very good state. I am very much glad. It's a real hustle, it's a real work hard. We've been fighting, we've been quarreling, we've been doing all sorts of things. We are friends, but if it comes to work, we really fight because we are aiming at something. We aim at something. Sometimes I have problems. Like Dr. Rezelman is my friend. Sometimes I said, oh, he's coming again. If he flies to Gambia, I said, oh, he's coming again. Because it's all about we want to achieve something. Achieving what? It's not our personal interests. We are willing to help our own community, because it's a shame to see somebody coming from a foreign country helping you and you don't want to help yourself. So a great thanks to Equator Foundation. I am very much happy. Thank you very much.